So in an age of job mobility and technology and innovation, Americans require a 21st century healthcare system that is affordable, fully portable, and highly personalized. We don't have a I always say we don't have a healthcare problem. I think we have a healthcare cost problem. And it's time for Republicans to offer a true vision for healthcare reform that will inspire a new generation of Americans to believe in what is possible, not just in what government says you must have. What we need is a vision of healthcare freedom. That is why I support the Republican Study Committee. They have a program called Healthcare for You, and anybody watching this can go onto their website, Healthcare for You. But I do believe that we do need to replace it.
Well, I'm primarily concerned with fixing the healthcare system, particularly people with pre-existing conditions. There's 6 to 7 million people who have pre-existing conditions, and the solution for that is to, I think, do something similar that we do with housing. They have something called a FAIR plan. So if you have a house located in an area that's more likely to have problems, then you can place that house in a FAIR plan, and all the insurance companies come in and draw that out of a pool. And I think we can do that with the 6 to 7 million people who have pre-existing conditions. I don't think it's just fair or anything because someone wasn't able to pay their health care costs to essentially bankrupt them. And as well as just the idea that hospitals give a big discount if you're an insurance company and individuals are charged at a premium rate. That's not fair. And I certainly don't believe the government is the best to run the healthcare system. I believe the insurance companies can operate efficiently and effectively, but they have a number of things that need to take place. I mean, in our system, if we went ahead and posted the cost of a surgery, then the hospitals would begin competing based on that, and we're not currently doing that. The other big thing, of course, really is billions of dollars is attorneys that are filing these lawsuits and getting punitive damage awards. It's in the billions of dollars, and we simply needed to relate the actual damages to the punitive damages. So I think if we do some of these common sense things, we could get it straightened out. Unfortunately, the trial lawyers, as an example, will focus their campaign contributions to the Democratic Party, and so there's a financial incentive not to fix that, where if you did something like what I do, I only accept contributions from registered voters within the district as a state rep, and I think that's the solution for a lot of these problems that seem like it's not possible to fix, but they are. But we have a swamp condition, so to speak, is what you hear Donald, our president, saying, and we can clean that up if we just had individuals that are registered voters within your district contributing to campaigns.
Well, you know what? We've been talking about that for a long time, haven't we? And we know the Affordable Care Act is not affordable. We know it adds a lot of paperwork for doctors. And you know what? At the end of the day, we didn't get to keep our doctor after all. But is the Congress really going to put up a bill to repeal Obamacare? We talked about that for the last 4 years. I don't think that ever happened. I'd say that if a bill like that comes up for a flat up or down vote, repeal Obamacare, I'd vote to repeal it. Because at the end of the day, I don't like big government. If something increases the size and scope of government, I'm going to vote against it. I'm going to vote for a balanced budget. I'm not going to vote for continuing to keep government open by continued resolutions to fund the government. That's if that's what you want, then I'm not your guy. I'm gonna shut down the government if we can't balance the budget. And Obamacare, or the Affordable Care Act, as it's better known, is basically it's big government. There are all sorts of solutions in states, and there's all sorts of solutions for people. Nobody is going to go without health care in our country. Our cities and states will respond. Our social safety net will respond. Nobody's going to go without healthcare. And, you know, the bottom line for good healthcare, really outstanding healthcare, a little fly there. Outstanding healthcare is a good job. If we get unemployment back to 3%, employers are going to have to compete with wages and benefits. And among those benefits are going to be healthcare, medical, dental, eye care, all sorts of good healthcare. And you can select your plan, you can select your doctor, you can select your hospital. And when you have choices in healthcare, the quality goes up and the price goes down. And that's what we need to do first and foremost. You know, I'm not so much worried about repealing Obamacare. I'd vote to repeal it if I get an up or down vote. But at the end of the day, what I do want to do is I want to get people back to work.
I do. The main reason is, again, given my experience in working across healthcare and really across the entire United States, what I've seen is that healthcare still is too costly, and we're not improving the health of our great country. Here in Kansas specifically, following implementation of the Affordable Care Act, healthcare costs for individuals and families rose by about 106% from 2013 to 2017, increase in monthly fees. So I think the American people have recognized that government-run healthcare, as opposed to healthcare that really, you know, we want the decision making to be in the hands of individuals and families. Individuals and families should be able to determine what their needs are in terms of the health of their family and how much they want to pay. What I'm for is smarter healthcare, transparent healthcare, and more affordable healthcare. And when I say smarter, I'm really talking about healthcare that encourages direct alignment and important relationship between the individual family and their provider, care coordination, providers themselves being thoughtful about containing costs. Transparency, very, very straightforward, is allowing people to know what things actually cost in the healthcare system as they're making a decision. And affordability, again, I think that families should determine what their needs are as opposed to mandates, and be able to make decisions about what they want in their care and what they want to pay for it.